Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So, let's take a look.
Hey everyone, today we are going to explore the world of Indanet, also known as Indomethacin. Indanet is a type of medicine that belongs to the non-steroidal anti-inflammatory drug family, or NSAIDs. It's mainly used to relieve various conditions like arthritis, gout, and some types of pain. If you've been diagnosed with rheumatoid arthritis or suffer from intense pain due to an injury, your doctor might prescribe Indanet. So how does this medication work? Indomethacin works by blocking the production of substances in our body that cause inflammation and pain. Simply put, it helps reduce swelling and improve your well-being. Now, let's talk about how to take it correctly. The initial dose is usually between 25 and 50 milligrams, 3 times a day. Once your symptoms are under control, your doctor might adjust the dose to keep you stable. And remember, it's super important to take it with some food or milk to avoid upsetting your stomach. Like all medications, Indanet can have some side effects. Some are mild, like stomachache or a little dizziness, but others can be more serious, like stomach ulcers or kidney problems. If you notice any strange effects, don't hesitate to consult your doctor. And there are a few things you should keep in mind. If you've had peptic ulcers or bleeding in the stomach, you shouldn't take Indanet. And, as always, strictly follow your doctor's instructions. In short, Indanet can be a great ally to relieve pain and inflammation, but it's essential to use it responsibly and be aware of any side effects. Thanks for watching this video, and take care of your health. See you soon.
If you've made it this far, let us know in the comments why you're using this medicine.